Double check the. I do that every time. All right, we got Jess watching. How you doing, Jess?
Hi, Jess.
We're going to talk about IBS, kind of our main focus of the first part of the year. All right, now we got some people coming on. And let's see, no one on Zoom, but that's okay. We're going to focus on Facebook Live for the most part. All right, so welcome everyone. If you're joining us live, we are here with Dr. David Bennett. He's a chiropractor and a certified functional medicine practitioner who practices in the Lehigh Valley, and I'll say down near Philly. What's the town? I always forget the name of the town.
Willow Grove.
Willow Grove, yeah, I thought that's what it was. So how you guys doing? Let's see, we got Jamie, two Jamies, Jamie Joe, Jamie Stover. Good to see you tonight. And for those of you watching the replay, if you have any questions, you can post them in the comments and we'll get alerts and we'll answer those after the fact. So anyway, we will get started as we have more people join here. But welcome back to Healthy Habits with Dr. T. It's Wednesday night. We do these live almost every Wednesday night as long as we're on a holiday or something else going on. And tonight we're going to talk about IBS, or something called irritable bowel syndrome, which we'll talk about isn't really a thing. It is a thing, but it's not really a specific thing. But we'll talk more about that in a minute with Dr. Bennett. So like on all my other broadcasts, and Dave's been on before, let's talk a little bit about how you got to where you're at today. What made you want to become a practitioner and a certified functional medicine practitioner specifically?
So I had a chiropractic practice, always did some nutrition, and was just seeing more and more issues and complaints from clients about problems that weren't getting resolved. And they had gone round and round with testing and still were not getting resolved. And everybody seemed to be looking at symptoms versus why is this happening? And so that just caused me to go get the advanced training in functional medicine, and haven't looked back. It's absolutely wonderful tool to look for that cause versus just, the symptom that's occurring right now.
Not to put you on the spot or I don't know, embarrass you or whatever. It won't be bad embarrassing. It's actually a good thing. So last time you were on, you were considerably fluffier, I think, not considerably, but you've done an amazing job following a program. One of your programs, so we have your functional medicine program, and then you have your metabolic reset program, which is your signature weight loss program, which is what we run in our office as well. So right. Tell the viewers how many pounds you down? You look a lot different last time I saw you.
I am just shy of 50 pounds. I think about 46 the last time I weighed. I had lost 48, so I fluctuate right in there. So it's like half, quarter of me disappeared, which is absolutely wonderful. Phenomenal program, and I know you have great success with it as well as we do with our clients.
Awesome. And it's been amazing to watch you, because I see you like once every like couple months maybe in person. Right. And it's like each time I saw you, it's like, holy cow, Dave's looking a lot different lately. So that's awesome. So
feel better. Always feel.
We could talk about metabolic reset some other time, and that would be a really good Facebook Live, I think. But tonight, let's talk about IBS now that we have some live viewers on. Hi, Marla. Hi, Leanne. Good to see you guys tonight. So anyway, let's talk about, just what is IBS. So first, let's talk about technically what is it. So what's the medical definition, or what's the technical definition of IBS? And then we'll talk about what it really is.
The medical definition is irritable bowel syndrome. And it's basically a diagnosis where the testing has come back inconclusive or negative. Endoscopy, colonoscopy, they're looking for Crohn's, colitis, inflammatory bowel. And it's none of those, but you're still having the symptoms of bloating, gas, alternating diarrhea and constipation, possibly some mucus in your stool. And then there's the subsets of that. So you have IBS-C, IBS constipation, IBS-D, just strictly diarrhea, but predominantly diarrhea. So a lot of times it used to be classified as, you may have heard it from your grandparents or your parents, spastic colon, nervous stomach. Sometimes that would get lumped right in there as the diagnosis, because there wasn't one. And then came the irritable bowel diagnosis that's used now. And it's just a conglomeration of symptoms, all bloating, the gas, the diarrhea, constipation, cramping, very bad pain during the constipation or during the diarrhea.
Basically, if you like the average patient that we see, they're going to doctors and they see they might see their family doc first and they say I had this stomach pain, I ate some foods, a couple hours later I got some bad stomach pains. They might have a lot of diarrhea, a lot of constipation. The doc gives them a few tips. They come back again, they have the same problem, and they say, okay, we need to see a GI specialist to make sure there's nothing serious going on here. Go to the GI specialist. They may do scopes, they may do some other testing, but at the end of the day, they don't really find anything wrong. So they just label it as IBS. And I believe the textbook definition is something like it's diarrhea, constipation, maybe one or the other, maybe alternating, stomach pains for a duration of like more than like 3 months. Yep. So really it's just a kind of collection of symptoms that they can't really attribute to anything else.
And all of that's good because you want to rule out the more serious things going on, especially if there's some blood in your stool, that you absolutely want to get that investigated, make sure it is not something bigger, that needs to be dealt with in a critical, acute situation.
Yeah, absolutely. Especially if you have a family history of colon cancer or bleeds or anything like that, or you're over the age of 50, they'll usually want to do a colonoscopy. You might have an upper GI scope, a lower GI scope, because at the end of the day, we're going to talk about some underlying causes which we test for and help people address. But at the end of the day, if we're working on yeast or a parasite or something like that, and you have colon cancer, well, it's not going to be good for anyone. So we want to make sure, we really want to stress, get the conventional help first, make sure you rule out that stuff. And then if you can't figure anything out, then that's when they come see someone like us, right?
Absolutely. Absolutely. Yeah. Fever, unintentional weight loss, that all of a sudden you can't, and you're losing weight. Those are all red flags that need to be investigated further.
Yeah, if you see any blood in the stool, and a lot of people are thinking like they see like the red blood, like fresh blood or something like that, but you might have dark lines as well, or it might be black. Yeah. And unless you're taking something like Pepto or you're drinking like a red beet juice or something like that, you shouldn't have any of those odd colors or any stripes or anything like that in your stool. And I say stripes because if you have a bleed, as the stool's moving through the gut, basically, you're going to catch that bleed and it's going to make that stripe. So anything odd. And we always tell people kind of like check out your poop and see what's going on every once in a while, because it can tell you a lot about what's going on. Is it formed? Is it the proper consistency? Is it the proper color? You get anything kind of funky, either funky shapes all the time or funky colors, then time to get checked out by a GI specialist.
Yep. I actually spend a lot of time talking about bowel movements.
Yeah.
But it tells a lot. It tells a lot. Yeah.
Absolutely. So we got the technical definition of IBS, but what do we know? Like our patients come to us, and as we were discussing before the broadcast here, I'm doing some research for a webinar that goes into depth on IBS and what things do you hear from patients? So we know what their symptoms might be on paper, but what type of things are these patients experiencing at home and in their life?
So what we usually hear is, eat something, immediately bloating, where, the common thing, I'm 5-6 months pregnant is what I feel like and what I look like. And it can be either constipation or diarrhea, and to the point of constipation where, I've heard, 2 weeks have gone by and haven't had a bowel movement, and comes with that all the discomfort of the bloating and the cramping and the pain associated with that. Because you're not moving your bowels, you're not getting rid of all those toxins. And the opposite side of that is the diarrhea, which, you can't leave the house. You're going 4 or 5 times in the morning. And then you're driving to work, maybe it's 20 minutes away, and every gas station, every restaurant along the way to make that emergency stop. Like I just heard it yesterday from a person who said, I was driving and, we stopped twice because I thought I had to go. And I really didn't have to go, but it's now so ingrained in their mind that they're concerned about it constantly, even when it's not a quote unquote flare up of the situation. So, it completely changes your life, whether it's going out to dinner and not being able to eat certain things, or, requesting certain things and eating them that you think is going to be okay. And then all of a sudden within 5 minutes, you're running to the bathroom. so it's really affects a person's life.
Yes. I mean, just imagine that. For people that don't have it, I don't think that people realize how devastating IBS, just something like IBS. Like you hear IBS, it's like, oh, I get a little gas, a little diarrhea, big deal. A lot of people that we deal with, you hear things like, they can't go for a hike in the morning, because usually in the morning when they first wake up, they're going all the time.
Yep.
You might go 12 times in an hour, first hour or two. So how are you going to get up, meet your friends at Hawk Mountain at 7 a.m. and go for a 3-hour hike, having no bathrooms around? You might have a porta potty or two along the trail, but I mean, you just can't do that stuff anymore. And it's not like you're going to take a roll of toilet paper with you and stop every 20 minutes and head off into the woods where people can't see. I mean, so hiking's out of the question. We got eating out for dinner. I mean, imagine going to eat out for dinner. You sit down, you have a little taste of your appetizer, and boom, that can hit you that quick where it irritates your stomach. And then you're running to the bathroom and you're coming back. So eating out's kind of out the window. And another one is just like you said, and I had a patient tell me this the other day. They know where every bathroom is between home and work, because they often have to stop. And even where they shop at the supermarket, or they're going to Lowe's or Home Depot, they know exactly what side of the store that bathroom is on, because when they have to go, they got a very short period of time before they have to really find something to go. So this is, it's a very debilitating, it's very stressful, anxiety and almost depressing type of illness, especially when you're not getting any answers from your doctors. And I'll pass it off. I'll pass the football off to you. What type of things do you hear from patients when they go and see the GI specialists? What kind of experiences are they having there?
Sorry about that. They'll run some tests the first time that it goes in. Sometimes they'll get an antibiotic, sometimes a steroid, anti-inflammatories, or a anti-constipation medication, or a Imodium type to stop the diarrhea. But it's not looked at. It's looked at as a transient event, and then when you're showing up again and again and again with the same type of symptoms, you might get a referral to a gastroenterologist who will do an endoscopy or colonoscopy to rule out the bigger issues, and who will then say, try this, or try getting some food out of your diet if they're open to that even. Sometimes they're not even open to hearing changes in diet will have any effect on this. And then you're sort of left floundering on your own to figure out what is going on and why is this still occurring to me, when all my, we talk about this a lot. My testing results are normal, but I still feel terrible. And in the functional medicine field, that's like the common statement that you hear is, this is all normal, but I can't drive 5 minutes. I have to go to the bathroom, or, I've been constipated for a week and a half.
So let's talk about the testing. You brought that up. That kind of sparked something in my mind, and we hear this a lot. And the conventional docs, the GI specialists especially, they're running some tests. Why aren't they catching some of these things? Why aren't they finding the problem? Why are they just saying no issues? It just must be IBS, just this mysterious illness, and there's nothing we can do about it. What are they? How are they missing the boat there?
So when those tests are done, they're looking for specific things, like erosions or inflammation showing up, where IBS is more of a functional diagnosis. It's the symptoms that are presenting and how the patient's presenting that gives you the diagnosis versus the testing.
Right. So they're looking for actual bleeds and cancer and stuff like that. But how about if they do this? Like some of them do tests for infections, right? Like what are they missing there?
Well, most of those tests are done, which is called microscopic. So it may not be even picking them up because it's not in that slide that's there. Or you may not be at a point where there's a flare up of what's going on, or, there's no inflammation showing up, or just like you said, there's no erosions, or there's no, tumor present. So it's not showing up on the scope. So it's not there. So there's nothing to diagnose.
So it's almost like they're looking for, if you don't have cancer or bleed that's going to kill you or anything like that, all right, there's really nothing else that can be done.
Right. That's right. Which is wrong.
Right. As we know. So, so you hear that a lot, where the test is normal. but you're still not feeling normal. So I always tell patients, well, do you think that test really checked for what it needed to check for? Because you're definitely not feeling good. So there's definitely a problem there. One thing I'll share is I hear this a lot, and you can tell me if you hear this, or if people, we got a good number of viewers on now. In the comments in the Facebook Live there, if you guys want to put, like, what things are you hearing from your doctors? If there's something that they've told you about the IBS, if you care to share, or what type of things have you heard from them? And then at the end of the day, they really don't have a solution for it. But the one I'm thinking of is maybe you should see a psychologist or psychiatrist. I mean, you've heard that before, right, from patients?
Anti-anxiety medications, antidepressants. Yeah, all too common.
Yeah, and it's funny because the anxiety and the depression's from the IBS usually, because they're anxious about what's causing their problem. They're depressed because they have this problem. They've had no answers for X number of months at that point. And they're anxious or depressed if they ask about that. Or they're probably saying that because some studies show that if you're anxious, that could cause IBS, and it's kind of vice versa.
And, that's a whole nother topic on the gut-brain connection. And, the communication between the brain and the digestive tract and what's going on in the digestive tract. So
that might be possible. There's a link there, but I don't know. I think there's something wrong with telling a patient, we checked out your gut, everything's good, it's all in your head type of
right.
thing.
That's right.
So what were we talking about? Okay, so the testing. So they're looking for, like on scopes, they're looking for bleeds, they're looking for polyps, they're looking for cancerous tumors and that stuff. And I've actually seen some do stool tests, like we're going to talk about the stool tests that we do.
Mm-hmm.
But the problem is that, we used to deal with, thank God we got out of the insurance business, but we used to deal with insurance a lot where they don't want to pay for anything to begin with. So the things that you want to test, you have to be very specific about what you want to test for. So when it comes to gut bugs, we'll just call them gut bugs. It could be bacteria, yeast, virus, parasites, worms. They test for maybe the 4 or 5 common ones. So they'll test for things like C. diff. We heard of that. Maybe an E. coli infection. We've heard of that, like in food poisoning, and in stomach flu, stomach viruses, norovirus, stuff like that. But outside of that, I think the testing is kind of narrow, where they don't really check for a whole lot of things. So when we talk about, well, why aren't they catching this? What are they testing for? That's probably why the insurance companies are just so stingy, and the doctors don't want to run a whole gamut of tests and then have you on the hook for the bill. Right. So I think I haven't talked to a GI specialist about that specifically. I did talk to a cardiologist that kind of shared those things in her field. But I don't know if you've had any experiences with that, or if that seems to be the issue for you.
I think that's an overriding issue in healthcare.
Yeah.
This, it's for everything. I got to be if you're in the insurance model, you have to justify every single test. And when you're coming in with, symptoms as, abdominal pain and cramping, bloating, gas, and diarrhea, I mean, there's a whole lot that can be going on to cause those. And if, to order that extensive would probably get flagged.
Yeah, I'm sure they have to, and they have to follow a standard of care. We have standard protocols and all that stuff. And when you start practicing outside of that, you start to open yourself up from criticism from your employer, because most of these practices are large practices, or they're owned by the hospitals, and I'm sure they have a boss to answer to. And if you're costing all their patients and angering their patients for costing them a lot out of pocket, I'm sure that's a problem. Or the insurance companies, you start ordering all these extra tests, the insurance company might ding you, and then you have to kind of answer some stuff there. But the problem is that sometimes, depending on the case, so if you have a problem and they've done the standard test and you're still sick, those are the cases where we got to kind of expand the panel.
Absolutely.
And look for those things where a GI specialist might say they're excessive. Well, yeah, maybe on everyone. You don't want to run 100 tests on everyone, but for that person that's still sitting at home dealing with constipation, they can't go for 2 weeks, or they're going way too often every morning, or they can't enjoy their foods. I mean, I think that'd be worth it in your case. And I'm sure a lot of you, and this is how I felt when I had an issue myself, a kidney stone a couple of years ago. I actually got to the hospital, and I'm not worried about the cost. I'm like, give me that CT scan, because I want to make sure my kidney's not going to explode. So go ahead and do some extra tests. And I think that the docs almost get to the point where they're afraid to ask people to pay out of pocket for more testing.
Sure.
So, and we have some people sharing here. So we have Amanda. She's like, I asked to run more tests, but 2 separate GI doctors refused. I mean, at that point, if especially maybe they don't know what tests to run at that point. So I don't know. So maybe it's just not all about the insurance. We have Marla say I've dealt with constipation since she was a kid. So yeah, so you have these problems all this time, and I mean, they're just not running the right tests, and they're not figuring out your problem. So let's kind of switch gears here towards, we kind of outlined the problem and why the conventional medical system is maybe missing the boat a little bit in many of these cases. And to be fair, 90% of the people out there, they go to the conventional doctors, they do the test to rule out the stuff. They might tweak the diet a little bit according to the doctor's recommendations. They probably do fine, because we're seeing the people that get stuck and then don't get help. So for the most part, they're doing fine. Then I don't fault the doctors or anything like that, but it's the more complex cases is when you need to really dive deeper. So let's go into that a little bit. So what would you say they're missing? So they're missing something, but what is the something that they're missing? Let's go into that a little bit.
I think the biggest thing that's not being checked or found is looking for what is exactly going on in the digestive tract, meaning what good bacteria are there, what bad bacteria are there, are there parasites, are there worms, is the good bacteria overgrown, is there yeast? Yeast is common in the large intestine, but if it can get, there can be too much of it. So that dysbiosis, when you put in certain foods, then, maybe the bacteria is no longer in your large intestine. Maybe it's now in your small intestine, known as SIBO, small intestinal bacterial overgrowth, and where it shouldn't be. So when you have those starches, those carbs, you immediately blow up, because they're fermenting it in the small intestine versus the large intestine taking care of it. So that's where I think the big miss is in this situation. What is going on in there? What's the environment? What's the I've heard the best term before is what's the ecosystem of the digestive tract?
And you mentioned SIBO, and that, I mean, this could be SIBO could be a whole hour in itself, but I was doing research for the more in-depth presentation that I'm doing on IBS, and I came across an abstract, a research article that said that 4 out of 5 cases of IBS actually aren't IBS, they're SIBO. So the interesting thing there is it's a totally different treatment. It's because with IBS, if it's just abnormal gut bacteria, or you don't have enough of the good bacteria, like that ecosystem's out of balance, you might get away, not all the time, you might get away with fixing the diet a little bit probiotics, fiber, and that helps reestablish that good ecosystem there. But we had someone mention here, so she's like, so Kathy here asked, what do we do for significant constipation? Fiber is not the answer. I'm glad she said that, because with SIBO, what's the problem with fiber?
Well, you're going to just end up fermenting, and it's just going to end up, you're going to feel worse. And that's a common treatment. Go take more fiber. And you'll end up feeling worse. So it's not necessarily the answer.
Yep. And to break that down a little bit more, so fiber is good, sometimes good for digestive problems, because that feeds our good gut bacteria. Right. But in SIBO, so most of our bacteria should be in the large intestine, which is lower down in our system. SIBO, what happens there is that the bacteria start to move up higher in our digestive system to the small intestine. And there really shouldn't be a whole lot of bacteria there. Those bacteria might be good or bad. It doesn't matter in this case. And what those bacteria will do is they'll start to release methane gas, which slows down the gut motility. So if you slow down the gut motility, constipation. If you get fiber, the fiber is going to go through your system. You take it orally, stomach, small intestine, hits the small intestine first. So that's the critters in the small intestine, which we already said aren't a good thing. They get first dibs at that meal. So now they start to grow more and more. They produce more of that methane gas. That methane gas slows down the motility, constipation. So it's amazing, because like going through this stuff, when we're learning this stuff in our programs, and it's like, this explains like half the people out there that we see, because they go and they try to fix things, and they use the standard treatments, probiotics and fiber, and they get worse, and you're wondering why.
Yep. That's exactly right. Yeah. And the other thing that's in there is there an infection going on in there that's causing the irritable bowel? Is there a virus, bacteria So that's another thing that needs to be investigated.
Yeah, because even if it is so even if it is, say, just regular IBS, we'll call it large intestine stuff, and you give probiotics and prebiotics, fiber, stuff like that, that's still not going to take care of the bad bacteria, the infections. So how do we? Well, first of all, how do we know all this is going on? So we know the GI docs, they're doing their test, it's not showing anything, or they're doing the wrong test, or they're not doing enough testing or the specific testing to show these infections. So what are we doing different? What are you doing different?
So, I mean, I know I use the same test as you use. It's called the GI map. It's a DNA stool test, which gives me parasites, some viruses, good bacteria, bad bacteria, bad bacteria in the respects of those bacteria, some of which have been linked to increased incidence of autoimmune conditions. It's giving me inflammatory markers. It's giving me blood in the stool. It's giving me just a whole host, parasites and worms as well. So I'm getting a broad spectrum of what is going on in the digestive tract, and it's allowing you to be better targeted with what you're doing versus just, the old, I'll take a probiotic and see how it goes. Because, some of those markers may, and you and I discussed this before, may show that your immune system, if you're going to try to rebalance the digestive tract, the immune system needs to be available to help. And if it's suppressed already, there's going to be some building process there before you can even go back and try to balance the digestive tract. You need to get the immune system up to help out with the problem.
Yeah, I like that marker because it's been the difference between, like, you're right, you don't want to jump right into trying to kill all this bad stuff off when your immune system's tanked. Yep. And there's a lot of inflammation, almost excessive amount of inflammation, because now you're taking this system, the ecosystem's horribly on balance to begin with. The gut's really inflamed. Now we're using these antimicrobial supplements to help the body kill off all of these bad things. And now you just got all of this junk kind of moving through the system that's already super inflamed. Yep. And then also, once they're gone, now your immune system's not up to speed. So what else moves in next? Is it going to be good stuff, bad stuff? You're kind of flipping a coin, and who knows what happens.
Yeah, there you go. As well as the potential for just the, when the bacteria, when you're trying to re-regulate the digestive tract, I'll call it, and you want to get a good environment. So if you're going to use some supplements or nutritional supplements, or the treatment plan includes something that's going to try to kill off some of those bacteria die. They emit a toxin, and you have to be able to deal with that and flush it out of your system. So if your immune system isn't there, you can have more of the effect of that, more of, like, they call it like a flu-like symptom when that process is occurring, and you want to minimize that as much as possible.
Right. And really, at the end of the day, our immune system is what's doing the work. Even with prescription antibiotics, they're helping to weaken the defenses of the bacteria so that our immune system can now, one, recognize them, and two, overcome them. Because usually it's kind of like a stalemate, so to speak. Mm-hmm. And our body needs that little bit extra help to overcome that. So all right, so we got this. So that's kind of, I guess, the main difference between what we do and what conventional providers do. And I know a lot of people are kind of wondering, what the heck are these docs, these functional medicine docs, going to do that's different than me? So I guess the summary of that whole thing is that, one, using the right test that covers a broad spectrum of different types of, we'll call them gut bugs. So what were those? There's 5 of them, right? So what were the 5?
Parasites, worms, viruses, good bacteria, bad bacteria,
and yeast.
Yeast is in there.
Yeah, I have bacteria. Good and bad is one. So yeast. Well, that brings up another thing. So if you guys are watching it, you guys might be able to relay this experience with us or share this experience. How many times you've gone on antibiotics for whether it's IBS or a sinus infection, and you end up with thrush or major yeast infection in other places? I mean, that's very common, because you might have a bunch of yeast in there as well, and your body might be able to suppress that because the good bacteria, the good flora, is preventing it from popping up. But then you take an antibiotic, which affects the good and the bad bacteria. And now next thing you know, boom, you got a major candida or yeast infection.
And maybe it was the yeast to start with, and there wasn't a bacteria issue. So now you've suppressed those even further, and the yeast have got, even more of a chance.
Yeah. So now we're adding all kinds of stuff. So now we got the stuff they don't usually test for. We got those 5 different categories. We got the yeast issue, because if you're treating bacteria and you got yeast, that's going to be different.
Yep.
So then that you kind of got to address both there. And is it the same supplements or the same medications for yeast and bacteria, or are they different?
It honestly depends on what the whole picture is looking like, and that's where, and I say it to people all the time when I'm talking to them, you and your sister or your brother may come in with the exact same symptoms, but based on the testing, everybody's different, and everybody's, plan is different, because there's no one size fits all, because, Dr. Buddy may have, abdominal pain, cramping, bloating, and gas. I may have the exact same thing. Mine's a dysbiosis, his is a yeast. So, or mine's a virus or a parasite or whatnot. So sometimes the supplements are the same, sometimes they're not.
But the supplements for the yeast is different than the supplements for the virus, right?
Correct.
A lot of times. So yeah, so it matters. So that's because here's another thing I hear, and you could let me know if you should have this experience, or maybe some of the viewers here have maybe done some of this stuff on their own. I have a lot of patients that come and they say, well, I did a yeast cleanse and my symptoms didn't get any better. And then we do the test, they don't even have yeast. Or they do a parasite cleanse. And I mean, this stuff isn't easy either. I mean, you're spending $300-$400 for 2 or 3 months, maybe more money than that, for 2 or 3 months worth of supplements geared at you parasites. You may not even have parasites. It might not be a problem.
Right. And that's the testing gives you where to go, because otherwise you're flying blind.
Yep. So you could specifically target what you need to target. And the other thing is sequencing. So we were talking about this a little bit before, where the sequence is important. So tell the viewers a little bit about that. Like, what do we go after first? What's last? What's next? Like, what does that matter?
Sequencing, my way I approach it is, first I'm looking at the immune system. Are they going to tolerate what I'm going to try to do? And if not, if I don't think that's going to happen, or they're already telling me my energy's gone, I can't walk up steps, or I can't sleep. So, maybe we're dealing with that first to get those issues first. And then, I personally, if I see parasites or worms, that's where I go next. Then I move on to the viruses and dysbiosis last, so to speak. And then going in after that to re-inoculate, put the good stuff back in, heal the environment so that the environment can then perpetuate itself with the good balance. So that's how I approach it.
Good. You're doing good. I have an outline here, by the way, guys, and I'm not following this at all.
Yeah.
I went off the rails after number 1. What is IBS? But anyway, I'm going to throw this away. But no, this is good. I like these conversations because you're coming up with a lot of good stuff, and you're not missing anything either. So you're good. Yeah, a lot of people don't know that. This is what you answered it perfectly. But worms, and people don't think people get worms anymore. It's 2019 now. Things are sanitary. We have closed sewers, all this other stuff. Well, how are we getting worms? I would say at least 20% of my patients show up with worms, roundworms, hookworms, whipworms. And guess what? Those worms have their own stuff going on. So those worms can carry. So these worms are actually visible. Some are up to 4 or 5 inches long. Some are a little bit smaller. But these other bacteria, yeast, and parasites are all microscopic. So they fit inside the worms. So one thing that we find, one of my theories, is that these people that go on the antibiotics, they feel good for a month. They go on this, they do some sort of cleanse, and they feel good for a month. That comes back again. They're not addressing the worms, because then the worms are eventually dying because they have a lifespan, or they're excreting their byproducts that has some of these other stuff in it, and then you get reinfected again. But yeah, worms. Everyone gets grossed out by that. I love bringing that up.
Well, and you sort of touched on it right there, as and is an antibiotic doing anything? Because then you open up the whole can of worms of biofilms.
Oh, gee, yeah, that's a whole other topic. So what's your 30-second pitch on biofilms?
It's where the bad stuff hides. It sort of encases itself in an outer protective layer. So you got to get that first before you can get into the inside. That's the, in a nutshell, 30 seconds.
Yeah, I like it at the pond scum, or like the stuff that sits in the bottom of the pond. You got the little fishes that hide down in there. So if the big fish comes along, they can't eat those little fish.
Yep.
So same thing with bacteria, the parasites. If you take an antibiotic, they just kind of dive deep under this biofilm, which is kind of like mucusy layer, is a good way to think of it too. And then the antibiotic isn't always effective. So a lot of details, a lot of like new stuff. And I'm sure if there's any practitioners watching this, I'm sure they'd be kind of taking notes too, because this is stuff that I didn't know up until a couple of years ago. Yep. So worms, that's one way of reinfection. So let's do one more thing here, because I think this is something I learned probably within the past couple of years too, is the sinuses in the mouth. We have stuff living in there too.
Yeah. I mean, you have your normal, but then, on the stool test, you may show up with strep as an overgrowth. And usually then you want to start at the top and work your way down. And that can have an effect the whole way down, because just like when you are eating food, your digestion starts in your mouth with chewing, and you chew your food, it starts to break down and signals for chemical releases. So, from your sinuses on down, if there's an overgrowth of the bacteria, and that'll show up on this test, a lot of times you want to start addressing it from the top down versus just addressing it in the bottom in the digestive tract, because then you're leaving the sinuses out of the picture to end up reinfecting the digestive tract.
Good. So we might have some connection issues here. My mom has lost us both, but that might just be her computer. But anyway, so we'll kind of wrap this up a little bit. Marla can still, everyone can see us. So it's my mom's problem.
Okay.
Sorry, Mom. She can't hear us anyway, so what does it matter? Anyway, we could talk about her behind her back now. So yeah, so the mouth has its own kind of gut environment, its own, what's the word you used for the environment of the gut? I forget what. Ecosystem. So yeah, our mouth has its own ecosystem as well. So you need to make sure that you address that, because again, a lot of people, we're talking about some ways here how you get reinfected, where it keeps coming back even though you're trying to treat it. The sinuses, the nose, the mouth, all that, throat has to be addressed as well. So we have a couple good comments here, questions. So let's go back to those before we log off for tonight. Sue says, with the increase, and these two questions are actually kind of related. Sue says, with the increase of autoimmune cases, I wish doctors would check more into gut issues, or at least refer to FM doctors. Unfortunately, most aren't familiar with us, FM doctors, functional medicine doctors. And yes, she's gotten C. diff from antibiotics. So that's common too, where you try to treat one class of bacteria and then something else pops up because they take over. And then Kathy, on kind of a related note there to autoimmunity, is we mentioned inflammation. What, if any, is the relationship between gut issues and systemic inflammation? So do you want to kind of touch upon those, autoimmunity and systemic inflammation, because they kind of go hand in hand?
So in the digestive tract, you have to remember that there's a junction between each cell, and certain proteins will get through there that are the right size. So if there's inflammation in the digestive tract and those junctions open up a little bit, larger molecules will go through, and all of a sudden your immune system has to go into action to clean those up. And, so that could be a trigger. So you always want to look at the digestive tract as part of any autoimmune, in my opinion, because otherwise you're just going to keep, chasing your tail, so to speak, because the issue is going to keep coming through. The same with food sensitivities, because if the digestive tract is leaking, your food sensitivity may be related to that, not really a true food sensitivity or food allergy. Systemic inflammation is, inflammation is involved in every issue out there. So, it's imperative with any inflammatory condition, in my opinion, to look at the digestive tract, to look at the gut.
Inflammation is, by definition, inflammation is very general. So we have basically inflammation is part of our immune system, and we have two types of immunity. We have very specific acquired immunity. So that's like our antibodies. So you get the chicken pox, you develop antibodies that only attacks chicken pox. inflammation kind of affects everything. So that's why when you get cut, the whole area gets red, swollen, puffy, you get pain in that whole area. So what can happen is that if you get inflammation absorbed in through the gut, then that can circulate around and can cause inflammation of other tissues in the body. And the way it gets in through the gut, like Dr. Dave said, our guts are like basically sponges or like a screen on the window. If it's supposed to allow some stuff through. So it's like the screen on my window here lets air through, it keeps the bugs out. But when the gut's inflamed and when you have other issues like dysbiosis where you have the wrong bacteria, there's a variety of scenarios where those gaps or those screens become, instead of screens, they become chicken wire. So now you get food particles, proteins, bacterial byproducts. Now that gets in through the gut wall. And where does it go after the gut wall? Is the bloodstream. Now your body's got to deal with all this extra junk floating around. It sees it as, hey, it's not supposed to be there. And boom, you get a systemic response.
And your body's doing exactly what it was programmed to do. Go clean it up.
Clean it up, attack the foreign invaders, defend it. And the problem is those responses were supposed to be, all right, we're getting attacked by a virus or bacteria, kill them off, filter them out of the system through the liver and through the kidneys, and then you're good to go. But when you're now exposing it every single day for years and years and decades, even in some cases, now the immune system's always on edge. It's always fired up. And next thing you know, it starts attacking itself.
I'll turn the table on you for a minute. So, and what's the standard treatment for that?
For autoimmunity?
Yeah.
Oh, conventional treatment? Then they put you on immune suppressing drugs.
Turn it off.
To turn it down.
Yeah. The best analogy I've ever heard for that is you have a leak in your roof. You hire somebody who says they're going to fix the roof. You come back in a day, you have no roof on your house. It's not leaking anymore.
Yep. That's a good analogy. So yeah, we've got on autoimmunity, but that's a good question. And autoimmunity could be an entire episode in itself. So, all right, it's time flies. It's 7:44 already. Like, I feel like we could talk about this forever. You guys should see, like me and Dave at a seminar between breaks and after the seminar, and we really talk like this and talk about this stuff. So it's very interesting to us as well. So any last questions from anyone, go ahead and put them in the comments. But while we're doing that, while we're waiting for questions, Dr. Dave, for the people in your area that are seeing you in both Willow Grove and the Lehigh Valley, or anywhere out there in the world, because we both work through telemedicine, how do they get in touch with you?
I have a website, empoweredlivinginst.com. That's the easiest way. A lot of information on there, a lot of blog articles, and a contact. You know, I do the same thing as Dr. Buddy does with, short consultations to see if what we're dealing with would be a good fit for what we do. And those are free. But, there's a lot of things you can do for irritable bowel yourself. Modifying your diet, decreasing your stress, avoiding certain, gluten, dairy, raw foods for that matter, just to see how it affects you. Because you can do the whole food sensitivity panels, but, you can also eliminate things and see how that affects your body.
Great. And the other thing too is, and again, this could be a whole episode on its own. You got to look back. So we like, as functional medicine practitioners, we like to call ourselves root cause doctors or practitioners, because we want to find out what causes your problem. So it wouldn't be good of us to just say, okay, we got dysbiosis, we got these abnormal bacteria that showed up, and we fix that and then let you go. Because why did they show up in the first place? Because everyone breathing the air in. You're exposed to mold spores, candida, yeast, bacteria is on all of our food, no matter how much you wash it. And a lot of that stuff's good. A lot of that stuff is a good stress for our body. It helps build our immunity. So we don't want to have people have like, oh my God, we got these worms, we got everything, we got to go totally sanitary, because that's not good for you either. And right. Studies show that when you're like that, you're more prone to having allergies later on in life. But anyway, so yeah, why do we end up with IBS? So I'll put you back on the spot. What are some underlying contributors?
Like we talked about the bacteria, we talked about the viruses, the dysbiosis. The triggers can be food related, or it could be, a round of antibiotics you had 20 years ago. It's everybody's different. That's one of the things that makes it not a hard, but more of an investigation to figure out what's going on, because the trigger could be well removed from today, and usually is. It's usually, this didn't start last month. It started 10 years, 20 years ago, and you're trying to figure out whether what you're going to do. Are we just you're going to feel good? You got to make sure what that trigger was isn't going to occur again. So we got to try to figure out that root cause, and then have you avoid it. And maybe that is a food sensitivity test or an elimination diet, or however we go about it, but you have to find that trigger.
Yeah, so eating the wrong foods, and raise your hand. I'll put my hand up for all of these who had antibiotics like twice a year through their teenage years, because you got every sore throat, sinus infection, and everything like that. You grew up in the 80s like I did, or late 70s, you're going to have, like, that's back when you went to the doctor if you had a problem, cough, cold, sniffle, sneeze, slight fever. And if you went to the doctor, that doctor was giving you something. It was usually an antibiotic.
Right.
So, and I mentioned this before in some of my other broadcasts, but one round of antibiotics, amoxicillin, kind of plain Jane stuff, disrupts the gut flora for minimum 1 year, up to 2 years in some cases. That's one round.
And that's supposing you're eating the good, fermented foods and good yogurt if you don't have a dairy issue, or you're using a probiotic, which, I grew up in the same era. Probiotic, are you kidding me? Nobody ever heard of it.
Yep. It's I found the medical book. So with the local library gave me a stack of books. They're all health related because they're just going to dump them and get rid of them. One was from 1936. The author in there it's like a straight up cautionary, like, beware family practitioners. It was written for family practitioners. It must've been like a med school book or something like that. But it said, beware, be aware that there is a natural gut flora. We caution the overuse of antibiotics. That was like in the 30s. And there's like a gap there where they just didn't talk about that at all. Now it's back again, fortunately. So, all right, everyone. It's getting late. We need to start winding down for bedtime. So we got to practice what we preach here. Don't stay up too late. Don't work too late. Go home with your family. So let's see if there's any other last second comments here. So Marla, this is very interesting. Thank you, Dr. Dave. Sue says, thank you both.
Pleasure,
very enlightening. Kathy says, yes, thank you. Marla says, thank you, Dr. G. Always a pleasure listening. And awesome. So, okay. Thank you guys for watching. I hope you guys learned a lot. Look for a webinar that I'm going to put out. I've been saying this probably for 6 months, but honestly, we're in the last couple of weeks of planning it, and then we hope to record it and release it sometime in February. But we can still help you in the meantime. If you have any problems, if you guys are dealing with IBS or any type of gut or digestive symptoms, they all kind of follow the same root causes, the same issues, and we got to investigate all the same stuff. So you can put different names on it. You can call it irritable bowel syndrome. You can call it SIBO. You can call it gastritis, or maybe you even have Crohn's or ulcerative colitis. So diagnosed specific autoimmune diseases, you still want a good gut environment, or what was the word you used? I forgot again. Ecosystem. You still want a good gut ecosystem, regardless of what else is going on in there. So in that respect, we can work along with your conventional doctors. Another thing I'll say is if you don't have a conventional doctor, you have digestive issues, you might want to come see us, because hopefully we showed that we know what we're doing, but you still want to go to a conventional doc, get diagnosed, make sure, like I said, you don't want to work on the ecosystem when you got bowel cancer. So you want to make sure you rule out those medical causes. I think that's exactly the place for those specialists. We want to make sure there's nothing big, bad, or ugly. And before we sign off, before we give Dr. Dave last word, Marla has one last question. Go ahead, Marla. Oh, we're delayed on Facebook. So anyway, well, Marla's going to type a question in a second. So Dave, any last questions, Dr. Dave, before we log off for the night and answer Marla's question last?
I'm just going to say, you may have had these symptoms and you may be living with them for 20 years, 5 years, 2 years, whatever it is. It's too long. Go figure it out. Dr. Buddy, myself, and other functional medicine practitioners, whomever, go figure it out. Your quality of life is important. That's our main concern, is quality of life. because we're not dealing with the acute care issue, life-threatening. We are dealing with the quality of life issue. So, you owe it to yourself to go try to figure it out.
Exactly. And it is effort, because part of the treatment is working on diet, and it's a lot of work, as some of you I know watching have been through the program, and it's not always easy, but for long-term health and just like you said, well-being, even mental health, from not having to deal with this stuff, not having to worry about where all the bathrooms are, being able to go out and go for hikes, being able to enjoy all that stuff. It does take some work, but people can do it. You can do it. You just got to stick with it. And there's someone watching that I know. I'm talking to you right now. You can do it. Stick with it, and we'll get over it. So Marla says the question is, can diverticulitis cause this? So I don't know if IBS but go ahead, Dave. I'll put you on the spot one more time. Diverticulitis.
I couldn't hear the question.
Can diverticulitis cause this? Which probably IBS.
Could it cause it? I don't know if I have a
kind of the reverse, huh?
Yeah, a good answer for that. But could IBS, yes, cause the diverticulitis, the inflammation there? Yeah, I would think yes.
Yeah, so it's that whole gut ecology thing, that gut environment, inflammation, that, and again, we go back to, you can name it this or that or the other. It's kind of all, just all manifestations of the underlying issues, whatever it pops up as, depending on what area it pops up on. So if it inflames the colon, they'll call it colitis. If it inflames the diverticulum or part of the small intestine, they'll call it diverticulitis, and that's lower left-hand pain. If it causes gas and bloating up higher, it could be called SIBO or gastritis if it's up in the stomach. So the name, I always say the name doesn't really matter. It's what is leading to it, because you can name the symptoms, you can name the end result, but at the end of the day, what's causing that named problem? And that's what we go after as functional medicine practitioners.
What's the trigger? What's the root cause?
We go after that. So, all right. I think we got everyone's questions answered. Thanks for being back on again.
Been a pleasure. Thank you very much.
Is this your second or third time?
Second time for me.
Second time. Okay.
We
good.
talked leaky gut, I believe, the first time.
Yeah. Real general that time. It's amazing because going through our trainings, and you're like me, we're always reading stuff. I feel like I didn't know anything back a year ago. So it's good to see how far we've come. Constant learning, constant modification. Awesome. Yep. So, all right, guys, thanks a lot. And we will see you next week. We got a health coach, vegan health coach, veggie-based diet, plant-based diet. So if you guys are interested in incorporating more veggies and more plant foods into your diet, whether you want to be a vegan or not, I think next week will be a good episode for you guys to watch. So, all right, guys, have a good night. We'll see you next time. Have a good night. Thank you.